ventrally, basically, or looking down from an anterior perspective in the chest cavity at the heart, there's a reason they're called ventricles, which is from the idea that they're on the ventral surface of the heart. So even though I know most people are accustomed to thinking about the ventricles as almost being more inferior or down at the bottom of the heart, the truth is they cover the whole ventral surface and make up most of the heart. The atria are at the kind of superior end, and these are what we call the auricles, or the little flaps on the atria. But most of the atrium, most of the chamber of the atrium is actually on the posterior surface, and this is all ventricle here. So to get oriented to a heart, which I think can be kind of difficult, especially when it's not in place, it's nice to see that ventral surface with all that solid muscle on it, and that groove, or what we call the interventricular, between the ventricles. Sulcus means a groove going between the two ventricles. And what you'll see is that the apex of the heart incorporates which ventricle? Left or right? Right? Looking down at this guy. This is the left side, this is the right side. Left side. No, left. And remember, the left ventricle is the one that is the big, has to be the bigger one, right, and more powerful one, because the right ventricle is just sending blood to the lungs. The left ventricle is sending it everywhere in the body except the lungs. And so, although this right ventricle in this perspective might look a little bit bigger, the left ventricle is much bigger, incorporates all of this, and as we'll see on the other heart, much thicker walled, much bigger, okay? And it incorporates the apex, apex meaning the tip of the heart. Right? Then, like I said, up here, these are the flaps of the atrium. They're called auricles. They kind of look like little ear-like flaps, and then the principal part of the chamber of the atria is on the back. All of the vessels enter and leave from the superior part of the heart. Okay, so even though the ventricles are down here, the big pulmonary trunk and the aorta go out the top of the heart, and then all the veins come into the atria, which is also going to be, you know, kind of at the cranial or superior end, mostly on the posterior surface. So I don't have this all that well dissected out, but what you can see at least, and this also really helps me get oriented, is the right ventricle here goes straight up into the big pulmonary trunk coming out the superior end of it. And see that big blood vessel coming off? That would be the pulmonary trunk right there. Okay. The aorta, exiting from the left ventricle, is always behind it and curving back around. And so if you look back there, there's the aorta giving off the big brachiocephalic trunk that goes to the right arm and right side of the head. So that's the brachiocephalic trunk, and separate vessels, the left carotid artery and left brachial artery. So there's the aorta starting to arch back, giving off those cranial arteries going back that way. And I haven't, like I said, I haven't dissected it out, but the aorta will continue around, and then if we just push everything aside here, you can really see it nicely on the left side, but against the back body wall. This is now from this perspective. There it is, arching back and going back down through the whole chest cavity, and then it'll keep going through the abdomen, which we'll see all of that next week when we look at the abdominal organs. We'll see the branches of the aorta that go to the abdominal organs and trace it all the way through. But at least you can see it coming back through the chest cavity. Everybody get a chance to see that? And you know, I think
aorta.
Aorta. Mm-hmm.
Gotcha.
Okay, kind of impressive, I think, for its size. The veins coming back into the heart are a little bit trickier, but if you push on the right side, right, this is the animal's right side, there's the inferior vena cava and the superior vena cava coming into the right atrium. So very flimsy walled. They don't look like much. They kind of come in almost right at the same spot. So you can see those pretty well. And then the pulmonary veins coming back from the lungs to the left side of the heart are just buried back here. They're smaller. They're two coming in from each lung, and I wouldn't expect you to be able to see them very easily, but they are going into that left atrium.
For test purposes, would you use like the pig or the sheep, or
Yes.
would you use the like model of the heart?
I'm not going to show you the model. I might use it for something really obvious, but I'm more likely to use the sheep and the sheep hearts and the pigs. Okay. So everybody good with that? Okay. So.